that patient prognosis will be better or the patient, the progress of the disease will be reduced. But what will happen if it is the risk factor? Again, you are giving burden to the heart. Like example, whatever thing is giving demand due to a high metabolic rate or high metabolisms, which will be induced due to like your if you are in obesity or your hypertension or maybe you take sodium increase the pollute load again whatever is give high demand on your body, the result is also demand to the heart that give the burden to the heart. That's why we wanted to exactly to screen out is these risk factors the patient is existing among these patients that also need to be ruled out, that need to be treated. Like earlier, we never thought about hypothyroidism linked with the cardiac disease. We never thought about it. Hyperthyroidism is linked with the cardiac. We never thought about it. The patient with anemia, definitely we know that how much it is the more impact factor to be taken care of. And even for urea, we never think about that. We know that it's maybe comorbidities or maybe multi factors which may be sometimes deciding on the contributing the disease or its contribution for the prognosis today. But as per the evidences, as per the many of the we come to the practices, we realize that these factors need to be controlled. We cannot treat immediately. We cannot remove it from this, or we can control that, make the differences in the patient outcome. That's why we wanted to know all these factors. I think I don't want too much about the symptom and the presentation of the patients. We already know that it's very marked symptoms, dyspneic and fatigue. According to that, you may have mild, moderate, severe. How much you limited your functional ability, then you can classify. Other than also, we can go with the gold standard ejection fraction, the one control how much the ejection fraction. We expected 50 to 60. Below that, 40, 50, 25, 20. That also makes the classification of patient how much you are severe in terms of the heart failure. So, but still, the presentation mostly is depending upon right side to left side failure. Right side, left side failure. Where is the compromise of the pulmonary function? Compromise of the systemic. Compromise. Systemic compromise means systemic presentations. Pulmonary compromise means the pulmonary functions. Like example, patient is dyspneic and fatigue. Dyspneic means systemic compromise. Fatigue is systemic, hepatomegaly, splenomegaly, or generalized edema, all are linked to right heart failure. This is where you are able to understand these are the presentations, make the patient, you yourself, nurses, to screen to understand how the patient is acting into that. Very quick review about the investigations. That is the hypertrophy, that is the chamber enlargement. I know that that is how the thin of the ventricle, thickness of the ventricle is divided into how it is dilated or hypertrophy. So this is also the most important matter. When it is hypertrophy, the chamber becomes reduced. The filling will be reduced. Yes or no? When it dilated, your ejection is the problem. Because already glassed, there is no force to eject. So in that way, we are able to differentiate these hypertrophy or differentiate between this thin and thickening of the ventricles, and again also any conductive disturbances. The conductive pathway, SC node, AV node, all this is bundle. These all for the which we want regulating the heart rate. That also will be disturbed. The patient will be getting this cardiac problem. Very quick on ECG. I am not going to give full detail, but still the ECG is a very core to understand about ECG normal rate and rhythm. You see rate, number of the heart rate and rhythm. Rhythm means PQ, RSP, go with the rhythm. And that way, we always heart failure patient, we expected that atrial fibrillation, P wave, how it is fibrillized. That is the most common among the heart failure patients. And also left bundle branch block. Left bundle branch block means there is a block in the left side of these branches. That also can indicate with this kind of ECG wave. There is a different leads are there. The most important lead you look into that is called chest lead V1 and V6. When you see V1, V6, it's a very typical pattern is RS pattern, or small r, capital S, that pattern will be there. And V6 is capital R pattern. If you look into this pattern, the patient is as have that presentation of their LVP, that you will be able to rule out for the patient suffering from this. Again, we visit the patient with a pneumonia, a pneumothorax, full effusions. These presentation also with the X-rays will be there. When you see the X-ray, earlier nurses never see the X-rays. Yes or no? Because general nurses we never we only collect the X-ray, give it to the doctors. But here heart failure nurses, they have to ECG also, you have to monitor, you have to see the X-rays because you need to compare between the patient, the old X-ray, new X-ray. That which you are empowered and you are trained. You can see the changes, hypertrophy is there, dilatation there. You can see that cardiac ratio, the cardiac thoracic ratio, how much is more than 50% you are able to see. So, this is the actual changes. What I can able to see here. This is the dilatations. How the hypertrophy is more than 50% means the cardiac chamber is enlarged. That we be able to identify. And also we can see this is a cardiophrenic angle. This is cardiophrenic angle. That also helps you know if there is a the thoracic is occupied with fluid, air. That angle will not be clear. That way we can able to decide the pathological or normal. That also can be differentiated. These are all pathological because here inflammation, parenchyma, the inflammation of the parenchyma is due to pneumonia. No? So again, here also that pneumothorax, air is completely filled with this. Here it's a fluid is filled. You will not find the exact over here. These all make that in emergency, especially the patient's fluid overload or due to some other complication develops, it makes the differences in the terms of this, how you are quickly, to diagnose the patient. Definitely, you don't need to confine with this. I diagnose the patient, I can treat. No, you can inform to the physicians whatever you do. Instead of screening, then he can also make sure that whatever you are diagnosis, because always good to know to between you and the physician you share and make the diagnosis, make the differences in the patient's the outcome. Again, the X-ray also I told you there is a changes in the inflammations. The result inflammation of the parenchyma, it's called separations, and escape of the fluid from the alveoli is called interstitial, and also in the the pulmonary. So pulmonary edema is a huge, most lethal complications. Suddenly, patient never died due to heart failure. Patient always died due to pulmonary edema. Pulmonary edema results in hypoxia. The patient going to the cardiac arrest. Mostly, you can able to see the patient. Suddenly, there is, they have developed, cardiac arrest because due to pulmonary edema. So, the generalized edema will not harm the patient. Pulmonary edema will definitely harm the patient. And echo, I already told the ejection fraction. The ejection fraction is a gold standard, and it helps to know in our nurses today, heart failure nurses, they are trained good enough to know the ejection fraction by echo. They are trained in echo. We give 3 months training for them. They can able to, they can able to do that echo, and they can able to tell the doctors and to the nurses or to the writing the documentation, but take time. You cannot do immediately. You should know the windows exactly. Every window that will take time, but you will be good enough. I told nurses can learn everything because your fundamental concept is very clear. Your anatomy, physiology, medical surgical, already you are well good enough. Only you know relevance. Why you are learning? Why you are learning? What you are supposed to focus? No need to focus everything. You are not going to rule out your congenital anomalies. You focus on what is the ejection fraction. It's more important because suddenly the patient coming with acute decompensated, the ejection is the key. Come to know why the patient is severe or not. Other than presentations, patient paroxysmal nocturnal dyspnea, dyspneic fatigue, all the things will give you alarm, but the ejection give you that exactly the patient is on immediately going to that. So again, for the many investigations, I quickly show you for you to know BNP, one of the most pro BNP also now BNP. The test is again one of the gold standard to know whether the patient is increased BNP more than 100. You can rule out the patient with the heart failure. And again, angio, I think everyone knows about angiography. That is a very basic investigation because I already told you the MI is one leading cause for the heart failure. So every patient go through angiography and Muga. Muga make you differentiate the functions of this, both the ventricle will working effectively or not, which give the output cardiac output. So whenever the ejection coming, go into the both chamber, how much it is giving function equally. And again, Muga can help you to know differentiate between hypertrophy and also dilatation of the chambers. That all again a stress thallium. I think they all nuclear tests will help you know exactly. I told the viability of the myocardium. Earlier we thought that how many vessels are blocked, how much what is the what stages of the heart failure. But we must know the stages of failure due to the either the viability of the muscle or due to the other contributing like valve impairment or other problems. Again, you have to correlate. For that, again, viability means how much the muscle damage, how much the muscle is still effective for contraction. That can be differentiated. This is not new test. Maybe I don't know you have this test or not in your hospital. In future, definitely it becomes pan India. Every test will be available everywhere. So these tests are giving a lot of clarity for you nurses. Why the patient going through these type of investigation to also to make sure, especially heart failure nurses, because the nurse nowadays patient asks 100% to you, why am this investigation needed or not? That time, please ask doctor. Don't tell like this. If you are independent practice at the heart failure level, you have doctor already empowered you that please give this type of information. That's what today these heart failure nurses already trained by doctor, they will tell you this by protocol, you can tell, you can instruct, you can do everything. You also satisfied that I can able to tell you, but you should be deliver that exactly information which he is supposed to give. But for that you should have knowledge, you should also good communication skill to justify. That is what the overall today objective of these programs to understand. So this is what another one is many investigation of basic routine. Sometimes we thought that all this investigation only very important or basic investigation. Yes, basic investigation is like HP, your urea, your creatinine, and even your thyroid function test. These are also most significant. There is a correlation with these all heart failure prognosis and treatment, which definitely interdependent. That's why we must do all the time screen out these all kind of risk factors before you proceeding for the any kind of treatment. Sometimes we thought that, oh, we are identify this, diagnose the patient, we start the treatment. But before that, we should also rule out all these basic investigation of proceeding for the further treatment. So again, the patient with a lot of comorbidities. What is the another important for heart failure management is patient not only with the disease, with the heart failure, with the cardiac problems, they are become diabetic, they are maybe hypertensive, they are maybe hyperlipidemia, they may be with the psychological problem, so many other comorbidities, maybe depression due to heart failure, or maybe some psychiatric drugs also landed with patients, maybe cause first. We cannot exactly, many drugs are cardiotoxicity drugs we are nowadays, they may be also landing into for a long time, getting into problem. So all are need to be, that's why nurses today need intensive knowledge on screening the patient, not like supervision, just collect history and do that. Whatever the physician is ignored or maybe missed out, you are able to pick up. That is the most important. You are able to pick up. Both are finally going to the track which able to help the patient. That's why we are educating now. Nurses are more educated to help the patient and do the better management and expecting the better prognosis. And you see this all the kind of management, pharmacological management, device and surgical management, lifestyle changes, vaccine. These all like pharmacological ABCD drugs. A means AC inhibitor, B for beta blocker, very easy to know for. And C for companion drugs, anticoagulant, anti-arrhythmic drugs. And D for diuretic. Very simple. Even a second year student nowadays enjoy it. When I was student, very difficult for me right there. What is this beta blocker? Very difficult to remember. Today, more easy for you to remember, recall. If you go with this algorithm and the protocol, very simple for you. But we are nurses, doctor, you make sure this all the drugs are written or not. That we have to make sure. That's why we are pharmacological device. I told ICD. I can show you these devices, ICD, CRT, and the ventricular assist device. All our device management is called bridge therapy. Bridge means before go for transplant, patients still can able to survive who are in the stage of the patient with the left bundle branching off. Lifestyle management. Whatever you do management, patient is smoking, patient is drinking alcohol, patient is eating more sodium diet, drink more fluid. Within 2 days, 2 weeks, 3 weeks, they're back to their emergency, whatever you give treatment. So you have to make the patient to adherence. These drugs is more important. Last is not least vaccination. So earlier we never think about vaccination for heart failure, but today we give flu vaccination. I think everyone knows about flu, and again if the patient is getting pneumococcal vaccinations. Why we realize that heart failure patient landing into pneumonia very common. It's not only due to, but still we wanted to protect them, prevent them. We are more successful because I don't immune compromise. It is very high among heart failure patients. So that's why we used to, advise them go to vaccine. I told already the pneumonia or pulmonary edema, this is more lethal than heart failure in terms of the mortality and mortality. So that's why these are the management we understood this all goal like it's a standard protocol as per the international level. It is not only at the age, you can go to anywhere these type of practices, what we can say best practices by physician to manage. So diet, I already told, restrict the sodium, restrict the fluid, and these are the common drugs. Very quickly, I say that diuretic very common. We use the drug name called Tital. Tital is a drug 5 milligram, 10 milligram, 20 milligram, very common. It's kind of good diuretic. It's a very good in terms of bioavailability and so the whoever taking that the drugs they are still good enough and nurses today our nurse heart failure nurses no need to wait for the doctor to prescribe. First dose only prescribed by doctor, followed by the nurses. They are able to do that. And inotropes, I think everyone know about inotropes. Yes? Yes or no? Yes. This is increase the tonicity of the heart muscles. It is called inotropes, dopa, dopamine, very commonest drugs. Most of the time the question will ask you, yes, what is the difference between dopa and dopamine? Sometimes I'm covering the BSc students, sometimes I don't even get back to talk about the basics. Because the very common questions for you in the exams also, my MCQs, which is when you choose the drugs, dopa or dopamine, when the BP is low, the urine output is low, BP is low, the patient are landing into cardiogenic shock, the choice of the drug is dopamine. Dopamine is the choice of the drug. The BP is stable, the patient with LV dysfunction, we know that through LV itself, the ejection fraction, or the patient with the symptoms, yes or no, fatigue, dyspnea, that time you go with the dopamine. This is the most important. Again, they are also different targeted receptor will be there, yes or no, dopaminergic receptor, beta-1 receptor. All also come to know that depending upon the doses which increase the renal perfusion or coronary perfusion, it's all other basics. But I'm not going into more detailed manner. But still, inotrope is a very important drug for you to understand. Next is vasodilator. I think everyone know about vasodilators. That's very common drugs we used to use nitroprusside. I think everyone know that. In common, we have different kind of vasodilator. Arterial also, venous also. We can use the drug according to the need. And neurohormonal anabolics, that's the most important drugs. Cardioprotective drugs, beta blocker and AC inhibitor or ARB. These are the inhibitor. You know that you wanted to reduce the demand of the heart, reduce the demand. That means your rate should be reduced. Then only the burden of the heart will be reduced. That only the heart can be survived for a long time. This is what the overall objective of this heart failure management. So in the case you are giving beta blocker and AC inhibitor in the cardioprotective drugs, that is the most important drug after discharge. Patient should follow. That is the important to understand. So other drugs like companion drugs, what I told anticoagulant, anti-arrhythmics. Anticoagulant patient who are at the risk developed with the thrombic embolic events or who are with the aneurysm, left ventricular aneurysm, who are at risk, they get into anticoagulants. Yes or no? Low molecular weight heparin, they start with subcutaneous, then they go into oral anticoagulant, whatever they want with the hospital, they go with the heparin, then they discharge, they go into the oral anticoagulant. This is what the anticoagulant, anti-arrhythmic drugs, that is the most important drugs. Patients who are under risk for developing ventricular arrhythmias, yes or no? Shockable, non-shockable rhythms. So that patient, you always go with the anti-arrhythmic drugs. The most common is amiodarone, very commonest drugs we used to give. These are the drugs are very important, like prophylactic drugs, which help the patient, save the patient who landing into cardiac arrest. Because this is the most important information for all nurses today. We have certain drugs need to be very familiar for managing the heart failure. Patient, sometimes it is not like in the olden days all white drugs, yes or no? Paracetamol also same. Cetron also same, yes or no? Patients sometimes don't know which drug very important, not important, yes or no? So sometimes you should tell them, I want to show you how we are giving drugs and all. We are doing the Ziploc cover. They should take and should remember also which drug they are taking because self-management is the only one can improvise the patient improvement, not with your knowledge, doctor knowledge. But what is your role? Transform to the patient. Patient never accept the disease. Big shot. It is like earthquake. our life in good. We don't know good tomorrow. We should be go with the certainty. Okay. So I think everyone knows about Ricky. Ricky made us to realize that day not only the suffering of that person and our life, but why we are traveling. Anyway, I think it's a break, 1 minute break for everybody that's informed. Anyway, I think 25 minutes I will try to finish it. Most of the things I covered in my initial. Yes. Yeah. Okay, we are normal, we are live. Okay. So we had that kind of trust in the understanding. Transform to the patient is more important. Transform not easy. The individualized their thought, their understanding, their education, their background, completely different than what you want. So that's why doctors easily prescribe, easily can write the medicine and give. The patient accept the drugs, follow the drugs, even though money, all the matter, their acceptance internally, which is what I told the Pata patient. No, I asked him, did you take any medicines? He told that I have 10,000 rupees in my hand, my saving after this much days. I know I am going to die. Why I have to spend this 10,000 for my medicine? At least this medicine, this 10,000, it help my son to get some, admission. You see that? They come to that depression among them that why I am going, I have to take the medicine. Anyway, I am going to die. But you see the family context. Please realize here, family tell, my husband stay for 1 day, 1 hour, it make the beauty of their life. Because you see both souls. One soul is thinking about, welfare of the family if I am not here. Another soul think about the soul will make the beauty of their life. Understand? This statement given by his son also told me. It's really emotional. And I felt that time, because we have seen many patients, many things in your life. That is a very important, crucial movement to make you something God is sent for that particular context to realize it. That's why I am transforming to you. Maybe you may think that it's for heart failure, but my thought, my impact on you that realize that particular patient. That's why today I am telling my student, whether whatever you are doing for the patient, I am not careful. But spend 5 to 10 minutes talk with the patient. And especially the patient who are sitting alone, nobody there with them. It makes you to realize why you came to nursing. Because the word is the very powerful. But you don't need to give anything to anybody. You are give money, nothing, no need to give. Your word makes the beauty of that. But that you need only skills. But God already given you through your what given you. God given you that gift. You don't need to do anything for them. With you know what I given you, my voice, his voice, to make the beauty of others. That is the only I felt that day when I asked you to do that. Today the heart failure nurses also, individually 50, 80 patients, the 5 nurses daily telephonically talking, about that they never feel it there, and even COVID we never lose any one patient. Many patients died for other, even normal patient or heart failure patient, he never died. That's what I am telling. Even you do not necessarily, whole India don't need to make change. One patient will make the change. Your life is something you are to get the reason. So in my program also today, what is my objective is what I am today here. Today it's open your eyes to realize tomorrow onward you feel your own way, something I do it. That's why my student told, sir, there is a gap between theory and keep it about gap. God given you to know, to talk with patients. And you understand this, what is the disease, how to translate to them, you understand. That itself you made being a nurse better way. You are literate medically, you know how to speak, and you are opening the eyes of the patients and make them to understand, and also beauty of the life of the patient and family member. This is what actually I am telling, because medication, you are so very difficult how the patient can understand. So you make them to understand that when you are, see, there is all that protocols. Actually, the very 2021 slide, I was because of break little bit we are little lose the track, but still my concept will be clear at the end of the day. So you can see this is the protocol. We have different management by different stages. We used to give it the start with the AC inhibitor, go with the diuretic, and beta blocker, AC blocker, then loop diuretic is not effective. The patient go with these kind of device management. And there is a different diuretic. We mostly go with the loop diuretic, Diantar. And I already talked about Digoxin, one of the drugs, very effective. Other than we go with the inotropics, Dopa and Dopamine. This is a very common drugs we are commonly using. I think these are all very basic for you. The difference between Dopa and Dopamine already I explained to you how it will be worked out for different situation and context. 3 vasodilators. We have mixed venous arterial. Very commonly we use nitrates, and also we use the nitroprusside. Also, but sometimes we common we use as a mixed one. All are related to the literature. We spoke very clearly. We understood at the end of the day of what we are managing is AC inhibitor, beta blocker are the very important medicines for the patient. We tell them don't stop these medicines. If you stop the diuretic, these medicines will only make you improvise in the survival. That overall we understand. I think everyone know about different drugs of AC inhibitor, enloxeril, captopril, and also for the losartan. The AC inhibitor are not effective, go with the ARB, receptor blocker. That also very common use losartan, losartan. These all the drugs are very good enough. I think everyone know about ROS mechanism that we use to inhibit the neurohormonal. For that we are using these drugs as even neurohormonal inhibitors. And again, beta blockers. I think everyone knows about today beta blocker role majorly not only for the BP, for managing. And lot of advantage of this. Most important is catecholamine effect. Catecholamine effect is very common. It's caused that cardiogenicity, toxicity among these patient heart failures. That all inhibited through this beta blocker and anti-arrhythmic, anti-accident, and anti-proliferative. So with that, I can already mention about anticoagulant and arrhythmia. This is all already I discussed with you. The overall, the drug management was for ABC drugs, whatever I not know. Okay, and this is also one of the very good things to show you. I think everyone knows about stem cell transplant. We are the pioneer in Delhi. We tested with animal. And we got a medical approval for the human also now in the process of stem. I think why I'm telling these all, and India level, what are the management in heart failure? I think AIIMS is the one maximum. We have the standardized management in terms of everything. This is also my clinic, heart failure clinic. Also, we did it. Dr. Sandeep Seth team was working on that. And I think this is the one of the device. It's called CRT. I think maybe most of the people who are medical surgical they know that. It's a cardiac desynchronized therapy. Usually pacemaker work on one chamber, but CRT work on 2 chambers. It's a biventricular pacing. And we know that we put it right ventricular pacing. But in CRT patient, you through coronary sinus, you put the epicardium of the left ventricle. Both ventricles will be paced at the same time. But the cost of the device is 5 lakhs rupees. And also it will have an anti-arrhythmic effect also. Like it will also give shock automatically the patient. It is a very good device. Today the heart failure patients who are in second stage, who are in the LBP, they are taking this device for survival of 5 years till your transplant. Very good effective. You will get also the injection, good injection. So another one device already I told you. Where you see this is the person is getting only 15,000 rupees salary. He is having the device of 50 lakhs rupees. Okay, this is the very since the government today given that type of empowering this economical people, providing this type of financial aid and support services. Overall, what is the medical services means? What is the right of the health is? Any citizen equally to get anything. Yes or no? At the cost free. That is what overall right of anyone health. It's a state subject. But if you are doing it, we are very happy. That has happened in US, happened in any other country, India also should get it. Yes or no? Either it is 1 crore also we should be able to provide. That way, Prime Minister Yojana means Ayushman Bharat, that so many missions they develop and do this helping this patient at the AIIMS level institution. I hope it will be transformed everywhere in the AIIMS, Kalyani, everywhere it will come in the future. We hope in that. And transplant, another one option. There is no option, the patient landing to transplant. And AIIMS is the one institute give maximum transplant as compared to any other institutions. And also I can show you the other picture of the transplantation. Now another 15 minutes, I will show how the heart failure clinic is running, how the inpatient, outpatients, and different services, how we are doing, especially nurse-led clinic. So I already told you so many things, already explained to you that what is the objective, vision, and everything. But overall, before we start 2016, we realized that this is what our traditional heart failure management. You can see patient come here, patient come to the emergency, patient is stabilized, we give an inotrop, we give IV diuretics, patient become stable, hemodynamically stable, BP and heart rate, everything is stable. Patient comes to the ward, we come to the cardiology ward for monitor. Then we will never give any unique, individualized education. We never don't have ABCD protocol of medications. Every consultant will give own treatment, and every SR, JR, the doctor also they follow that according to the consultant. And nurses never know that what is happening to the patients. So there is no additional medication, no additional information. Patient is discharged, no follow-up, and no communication to the patient. After 1 week, 10 days, we come to emergency, we come to know the patient is admitted because of fluid overload. They eat more with the salt, they drink more water, and they never follow the drugs. They, instead of taking diuretic, they take only beta blockers. So we understood that patient is sometimes cardiac arrest, on they die. So these all happen because of patient not understanding the disease, patient not follow up the medications, resulting in all complication and readmission is happening in India. That was the old, pattern or traditional pattern before start the nurse with heart failure thing. Now, after we started this, we have this vision, which we thought that overall what is the objective is give the knowledge to the patient. Who will give the knowledge? Nurse only can give. There is no option. They told none other than consultant itself told them. Your cardiology. We don't have time because they don't have time. They don't have patience. Don't have the communication skills. They have to see 10 patients. They have to take critically analyze what is the diagnosis. They are use their intelligence more. But most important is the emotional quotient. The emotional quotients we can develop more than doctor. Yes or no? Because already we have 4 patients. All nurses already have 4 patients. We know how to work with stress. So that's why nurses here only want the second option, who not at least equal but at far as much possible they can help the patient. So knowledge of the patient, knowledge, empower the patient, give the confidence and self-management. How many of them here, especially senior most, did you comfortable with the currently even your parents are suffering with a diabetic or someone with your husband will suffer some disease. Morning or afternoon, whenever you are in duty hours, you always roam about. Yes or no? You have taken medicine or not. Why you roam all the time? Especially female won't think about men think about women. Yes or no? And parents. Why you roam all the time? Why roam? Definitely they should take medicine, otherwise after going back they may be in hyperglycemia or maybe different level they will be problem, then again I will take to the hospitals. Suddenly I'll get any call from my family member because they are at a risk. Why? Because they are not able to manage themselves. If they are managing themselves, you will never worry about it. So overall, it is medical professional itself. You can able to see they themselves self-management is very important. Either your doctor, your nurse, they themselves will think about the patient. So patient, if they are able to manage themselves, most of the problem is solved. But how they understand and manage, and including the family also involved, and they also need to be taught. If they are, reinforcement not easy. Yes or no? You repeat. So that way, this is overall concept. You may understand, sir, what is the overall? We realize that nurse means only empowering the patient. Yes, but it is not easy. It is the very biggest challenge. Tell you inform the patient and make them to understand. Whatever you do, some titrating, investigation, everything you do, nurses, but everything can be done. Everything can be done. You titrate the drugs, you can able to investigate, you do all the rejection fraction, that can be done as nurse easily. But influence the patient, counsel the patient and getting the outcome. That is not at all easy because every patient is like your Himalaya. Their interest, their thought, their expectation from you. So fulfilling, satisfying the patient. That's why I'm telling you, that itself because you become master. That itself become you are the best nurses if you start to realize this. That's what we achieved from the heart failure. The patients are following themselves. They self-care themselves, managing. I can able to show you. This is what additional medication, additional education. The medication also you should know, nurses should know that, patient also should know that, everyone should know, transparent. And you are getting into the management. And home also they monitor, not talk about monitoring, no. You monitor the patient, your heart rate, you are checking. The patient should check their heart rate. Transform to you when you are calling them or by my app application, I will show you. That way you need a lot of skills required to make them to understand. I'll just quickly go into that because already we are getting, already I promised you for 1 hour, already exceeding 1 hour. So these are the team. This is all going to be like for you like video only. Because I'm going to show the exactly live picture of the age what we are seeing. So for all theoretical concepts, now I'm only going to show you that what are the things and that it's more interesting for you. You are going to see the nurses, how they are working. See, these are a team, very big team. In the heart failure clinic, very big team because cardiologists, cardiothoracic surgeons, many people. So I am telling you one more thing. Today, nurses working with the team is a big challenge. They need extraordinary communications for to talk with them, understand them. How do you get respect from the team? This is my question to the CDMO. Any MSc students are here? Yes, MSc student. Yeah. Yes. How do you get respect from your team member when they will respecting you? Most of the time we feel all that guilty, no, they are not respecting themselves. When you get respect, my dear, when they are equally to shoulder to shoulder, one of the consultant told me in the meeting, Dr. Gopichand and myself were shoulder to shoulder. You know, that is the really I was attracted to the word. Shoulder to shoulder, they consider you are equal. When they feel that you are equal, even about different teams members are there. Sometimes technician, sometimes dietitian. When you feel you are shoulder to shoulder, they think you. Even you are diploma or BSc nurse, whatever. It is not with PhD, you are faculty. Nurse, you are identified. When you get shoulder to shoulder, when you feel, they feel that you are very worthy. Please understand. When they make understand, oh, this nurse is worthy. Anyone consider that you are worthy, your respected mother is more good, yes or no? Because she is the most worthiest person that in your life. She may not have money, she may not have position. So that worthiness only you have to show to that any of the person through your knowledge, through your skill, through your attitude. That way they will think that I cannot stand. Sometimes the consultant is very knowledgeable, very rich, but the way he behave, nobody can respect you. But you may not have maybe that much knowledge, but your attitude is make the things different than another person. But this is the most important. I am again telling, still you maybe have some bad experience with many people. But not exactly told us. Good people like for only good things. But that number is nowadays increasing. Yes or no? Because everyone realizes that whoever coming realizing the fact of the life, the number is increasing. Who didn't realize even he is 65 years, 70 years, he is a big millionaire. But he may not know the realizing the fact. He may be the millionaire, but he may not be the person. Understand that? So good person always look for the good things. So that way you will attract the good people with your whatever I told you as a good professional. So that way we are really wanted the good team member to realize. Okay, anyway, I quickly told these all our inpatient, outpatient, and rehabilitation, home management. We have 4 areas we are working, heart failure nurses. I'll show you one by one. We are all these functions of the heart failure nurses. You see how many function. Why I'm telling this to you? Every time you feel when you go generalized care, taking vital temperature, documentation, you give medication, yes or no? These are think only the function, but when you become specialized nurse, from the assessment itself, it's a huge challenge. You do inspecting, palpating, auscultating, You do, I told you, rule out all the ECG, X-ray, understand? You feel it, so you just learn. That is what need of the hour for the specialized nurses. When you become specialized, you start to learn more. You start to work more. You will find more challenges initially, but you become more good enough. That also make you that more good in the system. And all other function I told about rehabilitation, promotion, all other are come by the way you are telling follow up, home care, everything we are using on the same way the role of this. See, earlier I told you, before start the clinic, mortality, morbidity, this is the only outcome we thought that every time focus. I think faculties are doing many research today about quality of life. Yes, sir. That is the most important outcome, patient satisfaction and the quality of life, which is really expected. That only show your functional level. But we can only the nurses today can read this. Without nurses, you can see my all the papers, you go to the Google, you can see all our outcomes reaching this type of things. But earlier, mortality and morbidity is only one which is able to reach it. You see this our colleague, and you can see my student. We have the clinic. This is setup of our clinic, heart failure clinic. And it's going to be finished, don't worry. Ah. This is the setup. Usually, setup cardiology only will be sitting over there before. Now, initial assessment done by our MSc cardiac students, we are giving training for them from the basic. Even tomorrow, I told Dr. Ashish told, we'll start this MSc student who can also come in the training. He told that very positive. I got it from him today. And you can see the Subin, Mr. Subin. He's the one doing the heart failure nurse. They also he given training for the. We have separate room, individualized room given for the heart failure nurse. They can sit alone. And also we have so many special cord. I will show you also. And also we have some yoga training. So many places we have some dedicated places for meditation, yoga. Heart failure nurses come in very systematically, very comprehensively, holistically give the care when they go out of this, the management. They will not only for just take the treatment and prescription go away, because whole team will work for completely to manage this. I'll go you one by one showing that this is our admission sheet. We have dedicated sheet. Actually, all are mentioned about only heart failure concern. What are the risk factors? What are the causes? And everything is built by only heart failure nurse. You can see this is stamped by heart failure nurse. We use the stamp. We never write. So many times handwriting errors is a common. We may not understand. Even nurse cannot understand how the doctor can understand. Even another doctor cannot understand when the other one is writing. So we keep C, A, B, C, D, I told you. We write, put the stamp. Every patient should get all the drugs except some contraindication among these patients should write it. Why not? And again, you can give the very respective manner to give to the patient, not like put like you give medication. We give every cover, we give the medicine A, B, C, D. And every Ziploc cover, we explain them in Hindi bilingual, we write it and educate to the patient and give it to the patient. Family also involved during teaching. Sometimes patient is very depressive, sometimes may not be able to hear you. Family member also should listen and they will also follow. And they will, after 30 years follow, they will tell this many medicine we took it. But today we have app also that application they can able to follow up also, getting out of application. So this is the most important point which you have to provide to the patients. And we have exercise training. We always think heart patient should not move from the bed. This is our concept. Yes or no? But it is a very wrong concept. We should have very good what we need to motivate the patient to all kind of range of motion. According to the patient stages of the heart failure. We can tell them to move out of the bed, do ROM, range of motions, flexion, extension, different area. We improve the patient, their appetite, improve the functional ability, and patient also feel, that they can able to, they are improving in terms of the quality of life if they are coming out of the bed and doing all the activities. This is the most important. That also teach by the nurses. Individually teach. We never like you give some booklet and go and do that. Because every patient have a limitation. They pick up. Some patient quickly they learn it. Some patient they may not learn it. They will be very much, I don't want to do that. So make them to be understand and do this is the most important. And I think he already mentioned, I was also limited to go into the technological side. But still, initially I got resistant from the aims. But with my effort, I connected with the IIT Roorkee. Again, same only good people connected with the good. Yes or no? This Dr. Deepak, his family suffering heart failure problem, family. He wanted to work to support the people who are working heart failure. I got his number, I called him. Initially, who will not support, nobody will support nurses for giving this type of support. He told me, no problem, I'm ready to support you. I think the first one, my app came in India, India Today, everywhere it was, published. The nurse, waited that app for the heart failure patients. This was that food too, which the patient, I told you, any patient going out of the hospital, we are not able to connect it. So this app able to connect, and it was also help the patient. I'll show you the app later on. And we have also Hirday card, and Hirday card is also individualized. Every patient is given for checking the weight and their vaccination, their exercise, everything will be marked. Every day the patient will record the weight every day. And we also should teach them how to record the weight. Early morning, before breakfast, after boil the urine, using the weighing scale and ask them to check the weight and monitor every day. That is the most important education to the patient. Important education to the patient is checking the weight of the patients and screen them and make them to be 3 level. Your high risk group, no risk group. That means we have 3 zones: red zone, green zone, yellow zone. Red zone means they are under big complication. They are in pulmonary edema. The patient immediately need to be mobilized. You have to find it part. The next one is yellow zone, stable, but need to be reinforced every time. Green zone, they have no problem. Every 30 days they come to that. These all do by nurses only. These all do by nurses. You also make them to be understand. I'll quickly go to my app. This is what initially I started with the video conference, even during COVID and all. Still, after developing this app, I think go to the Google, you'll find out that the 2 app. Today, patient, they are sending the BP, heart rate, and the weight every day to the heart failure nurses. We can able to know. Example, I'm asking one of the nurse here. The patient weight is increased more than 2 kg within week. What do you understand? Is anyone male nurse? I just involved you, otherwise you think that. What do you understand? Every day patient is getting weight is maybe 60, now suddenly you think 62. A heart failure patient is increasing the weight, what do you understand? That is the fluid overload. So immediately give alarm for us. The app will give this patient fluid, immediately need to titrate the dose. You have to increase the dose of the diuretic. Yes or no? So you get it 5 mg, become 10 mg. You can able to do that. This message go to doctor also, this message come to you also. It is documented. This is one of the very good app. The patient BP suddenly dropped down. You immediately message will come to you. Patient heart rate is again going down or increasing. It will come to you. One of the very good is the app. I'm very proud to say. You can see the ECG. They can send the ECG also, X-ray to you. So how the technology was maximally utilized. So recently, my app able to, to capture the LVP and it give diagnosis. I already tested 300, ECG with this IIT Roorkee. And even today, doctors cannot able to interpret it. You go to MBBS doctor, they cannot know LVP. But your app will give you that immediately you go to the doctors, you manage it. So I am telling, that's why I am telling nurses not only knowledge and practice attitude, I am telling nurses we are highly intelligent. Nurses to utilize the intelligence to do some creativity. That creativity make the change of the patient life. That give identity for you. Being nurses are not less than you. Understand my point? That is the way I can want to tell you when I received the award, national award, I felt it myself. Many nurses have that capability. Yes or no? It is not only aims working in the faculty, but only they may not get opportunity, they are not motivated. So that way I realized that what we reach the nurses to get into that more to do. I did it in cancer patients, so many work going on like this. And quickly I move into that because we have very shortage. See, this is another checklist also we followed for the patient is the inpatients. We know inotropic, diuretic, so many things are there which you used to follow the checklist. Actually, I'm on time only, don't worry, because 1 hour 30 minutes I made it that way. But still, if I leave you again, I take another 30 minutes. Then I have to catch my flight also to 30. So don't mind, that's just 10 minutes because you will not get this information anywhere. No book available with this information. Only if you are feeling it, it's good. If you are not feeling, I cannot do anything because I didn't get opportunity when I was very student like this. Okay? To know. Okay. You can see this is the checklist. Another only 4-5 slides to be good enough. Okay. Diuretic, IV, inotrope, AC inhibitor, all are, see, usually what you do not go to ICU. Any of the practices you do in ICU. Doctor what prescribe you do, yes or no? But here, every heart failure patient, heart failure nurse will go and tell the doctor to follow this. Opposite. And they will sign. In not only in ICU of the cardiology, ICU of any medical ICU. That much they power they give it to the nurses. And doctor to mistake, they will write comments, he is not doing well. So immediately you will receive the message that you have to correct it by the HOD. So that much we have documented, and the nurse know when to start inotropic, nurse know when to start, all with the parameters, when they check the electrolyte, when they check the BP, when they supposed to start inotropic, when they supposed to stop low molecular pairing, when they start anticoagulant, everything they know by the protocol. That's one of the very beauty of the protocol. Protocol give aid you, direct you, what you supposed to know, what you supposed to do. And again, I told about education is the most important. Changing the person free from alcoholic is not easy. I think everyone family would have seen the people. Changing the person free from smoking not easy. Not by one talk you will not give it. Boom. Even I have seen some patient after CABT. They give promise to the wife, I never smoke. But after they increase the smoke, because God has given second life for me. First life I finished, now second life I want to enjoy more. So these type of people, they never think about the family in their absence, how much they suffer. So you have to influence them. It's very difficult, I'm telling that it's a very difficult challenge for you to influence them. But still, you have to go in their way. Because I'm experienced through my student also nowadays. Earlier, we student follow very easily with the teacher. Even teacher is very strict. Very strict. We keep that much distance. We love to follow the teacher. Good things. Even yesterday I discussed. But today very difficult. Yes or no? But today teacher what go with the student, change the behavior. Go with the student in the friendly. Understand? And change the behavior. That is it. That is today the change, transformation. But we are enjoying it. But what is the outcome is need to change. We will not give that, we will, accept it. Because you are more much you are benefited. But earlier we only see, like my parents, we never talk, my father, I never talk. But all we learn from him through is from out. But today with my son, I go with the play with him to change what he wanted. See that trend? So that is what today patient also, you cannot, you are not, I smoke, the patient is not changing, you cannot get angry with him. You try to make him to slowly understand the importance of life. After some time they will change. But that is also the family also most important involved because you cannot stay with them in the family. So involve the family also more important. Anyway, I just quickly you see our nurse working at a transplant and also the discharge is usually discharge sequence is one of the very good protocol. You should discharge only right by doctors. Here discharge right by the nurse. Even they also write about doctor whether they given proper instruction, everything, whatever they have done, written, they checked all the investigation, all their parameters, their functional ability, everything will be. This is all already given as a RCT. We publish the work, even it is in the book also, in our book it is there. So it is for the device management. I already told about the device. We also have kind of patients we do with the device, and also heart transplant. You may think that heart transplant, heart failure not are divided. Patients who are in the heart failure, they are waiting for the heart transplant. So their nurse will follow up and follow up of these patients who are coming with the donor means a heart. Every time the newspaper come now, this heart is flying from this place to this place. Yes or no? This is also coordinated by heart failure nurse. And he's keeping time. He's keeping time. Within the time, the heart need to be donated or need to be transplanted. Again, it is be followed by nurse. And we have checklist. And after post transplantation also, we have follow so many things. Most important is the rejection. Yes, sir, the rejection. Rejection is the biggest challenge for nurses or paramedicals. Whatever they done too much, 20 lakhs rupees is for the expense of the surgery. And again, we have follow antifungal, antibiotic, and antiviral. So many drugs they have to follow. The patient again waiting for rejection or not to know, that is taken by endomyocardial myocardial biopsy, EM biopsy. That is the most important procedure. They used to go through to take whether the patient is falling, getting the complication of rejection or not. So we have also checklist which you have to follow to go through that patient undergoing transplant. I think this is a good data. I think everyone is able to read. This is what overall my objective of the today's presentation. This slide only. What government is always saying that nurses need not necessarily more educated. Nurses, I think the normal practice good enough. Yes or no? But when you go into the work, I told you, lot of rejection, lot of objection. Mobilizing 5 nurses. Why nurses need to be specialized? This data today is speaking about it. What is the data? Before start nurse-led clinic, 72 heart transplant in AIDS. 26 patient only was living before we start the nurse-led clinic. Now you see, I think everyone knows the mathematical component. I believe out of 23, 20 patients are living. This is the really because of nurses, even we earlier everybody know that, but they will not agree. But we are talking about research, all data now. The data only, even one was telling doctor, trying to get the data right. Data only speak to the policy maker. Data only convince the policy maker. Data only convince your administration. Even for madam is telling what is the input, what is the outcome. Outcome will show everything the data. So data only make to convince. That's why today they are telling start more nurse-led clinic. I am very proud to say we started post-EMI clinic, we started cancer clinic, we started the organ donation nurse clinic, we started palliative nurse clinic. It's a really wonderful. Today we are able to. We may not have the nurse practitioner games. We started almost 78 nurse clinics. This is the reason I come here to tell this. Today, many of the nurse-led clinics started across India. My journey will continue. I was very proud to say, when you nurse, all the time do finally they keep the name last name. Yes, sir. Whether you are faculty or nurse. But when I came from abroad, I was 10 years as a principal. I realized that when I see the suffering of the nurses at the age, I want to do some different. Same time, I want to be, to put nurses in the top, either me or anybody. We never just work alone and get to name somebody, get into give name partner. We have to work shoulder to shoulder, but we should know everybody. We are the one easy. Understand that? That's why all the time, and also we work with everyone. It's not work only with the faculty. We should work with the nurses, clinical, because they're highly productive, highly, resourceful. Day to day, they only know the management. That's why my team always go with the faculty, nurses, doctors. We are able to lead. And this is a concept why I started this clinic. I told you why the nurses recognize there is a continuity is missing. Yes or no? The patient need to be empowered. Nurses only can replace. That's why we started. I'm very happy to say that I was not only in India, across the world. I just opened the eyes of the nurses. It's on heart failure, other than how the technology can be used, and it was recognized that the work is not only at the age outside. Because I'm telling you, sometimes we feel that Indian nurses not able to prove it, and Indian nurses not able to go out. But Indian nurses with the challenges also can come out. Understand that? Because we become more stronger. We cannot go into the level. And this way, I'm very happy once again for everyone to patiently hearing even the lunchtime. I made you to stuck. I know that, but today one or two nurses or nursing officers, they think that I have my scope. I have energy. Definitely, everyone knows that today morning you realize I have energy, I have intelligence. Why they are putting me down? Why no scope is there? No them. You want to survive. You want to come out. You want to go in your way. This already destiny is there. Only thing is how you jump up. The way you're looking. Somebody is lighting. Somebody is showing. Or I have to find out way. When we were there, nobody then to find out the way. We thought that we have to go with the same level only. But there is a people today, whether your principal or me or management, there is a many people are there to try to show the way to the people, but not necessarily follow their way. Follow your own way, where you give your identity. Or your identity. Today, talk about Gopichand nurse actually. Gopichand is informatic. Understand? It's my interest I'm working. Same way you start with your own area, own interest, but being a nurse, that is the one make you to the development of the profession and enjoy and you never defeated. Otherwise, why I'm telling, when I was the first male nurse in Tamil Nadu, when I joined, lot of stigma for me accepting as a nurse. Then one day I realized whether I get married or not. You understand? Really, I'm telling that much stigma. Male nurse, no job, nothing. Then I realized somewhat I was I was like a suicidal attempt. That means go out of the the profession. Whether you can stay. But today I feel myself I've done some contribution, some memories. But one feeling I didn't defeated myself. Why I'm telling? If I went to another profession, I prove it. I may be defeated. I was not able to adapt, accept this profession, my survival maybe. But now I can work with anything because the challenging profession itself I made myself to satisfy it and accept it and moving forward. That make you the beauty of your life and make you that be the better person. The God decided you that why you choose this profession. Why He chosen you that in the professions. With that I conclude my talk and thank you very much for that design. Thank you very much. Any doubt, anything you can ask me. That is actually need of the time in your lifetime. But still, I'm happy to listen.
Anybody else want to ask
Anything, not related to hardware.
please come up with your.
Thank you very much, sir, for such an informative session, listening to which itself was a feast to the mind. Famous philanthropist Abraham Lincoln said, "If I have 6 hours to cut down a tree, then I will spend the first 4 hours suckling the axe." I hope the time we have invested in suckling our minds will definitely be useful for us and society in future. I request Madam Principal to felicitate our honorable resource speaker. You requested to come to the stage, ma'am. Please, sir, please, ma'am.
Last week I went slot. I got one like this. The company right in meeting. And I'm proud to hear this because whenever we feel that we are Indian, we go to different places. Even though I'm familiar with when you come to age, I realize that how 50 years in Indian to work with the people, understanding. That also I am very blessed. Okay, Maudik, I told you. I know your rich culture. When we are small kid, we learn all the about West Bengal culture of the. Today I am meeting because of this forum because I'm able to impact this land and getting the blessing of Kali and you meeting. Thank you once again.
I request Principal Ma'am to stay on the stage as we are going to deliver the certificates of today's program. Since we have come to the end of the session, may I please
We have
request
one moment, sir.
I request the representatives to come forward and collect the certificates. MSc first year and second year representative. Come fast. JNM third year. Representative of JNM third year. Representative of BSc second year. Clinical instructor, Ms. Gargi Chatterjee. Thank you, ma'am. JNM third year representative. BSc second year representative. Thank you, ma'am. Thank you, sir. Since we have come to the end of the session, may I please request the entire gathering to rise for the national anthem.
जनगणमनयधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उत्कल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
With that, we end our session. Once again, I thank everyone for joining us today. Have a nice day.